everybody, and welcome to the DEARG podcast. This is the podcast that brings you education and information on endometriosis and adenomyosis. My name is Kathleen King, and tonight I'm joined by Dr. Neesha Patel. Neesha is a qualified independent health psychologist and founder of Evoking Health in the UK. She founded her company in 2022 after working across long-term chronic health conditions and obesity in the NHS. She was awarded her PhD from the University of Manchester in 2013 for her research in managing long-term conditions and in particular type 2 diabetes in the South Asian population, and importantly, the role of social networks in supporting management of this condition. Neesha is currently working part-time in the NHS in diabetes care, as well as running her own company, Evoking Health. Neesha, welcome to the DEARG podcast. Would you like to tell us a little bit more about yourself?
Hi, Kathleen. Thank you so much for inviting me onto the podcast today. I guess just to add to the intro, I've worked across, quite a few chronic conditions and helping people to kind of, I guess, break old habits, create new habits, and really try to live their best lives and to kind of take on board their current health situation and provide that kind of meaning and purpose, as well as looking after a chronic condition, and just being able to live that rich and meaningful life as much as possible.
And that's so important. And this is one of the things that I try and get across on the DEARG podcast, is that we can use all the little tools and tips and tricks that we can gather together to make things a little bit easier, because living with a chronic condition can bring a lot of challenges. And we hear a lot about multidisciplinary care in endometriosis. And it's one of the things that is thrown about quite a bit. And psychological support is one of those things that's in there. But often when I speak to women, there's a fear because a lot of them have gone through either medical trauma, they've not been believed for a long number of years, to try and get their diagnosis. So I think tonight we'll try and have a conversation around breaking down those fears and breaking down those sort of barriers to maybe seeking some help. And if you think around, I suppose, like endometriosis probably overlaps with a huge amount of chronic conditions. Have you seen a lot of endometriosis patients in your practice?
Yeah, so in the specialist obesity services, I came across a few women, but it was interesting because they didn't quite understand their symptoms as much. They, a couple of women would mention that they think they have endometriosis, or they're waiting to see a medic in the health service. But a lot of their symptoms were kind of intertwined between what was going on for them in terms of their weight management, their hormones, and of course their kind of weight management journey. So the impression I got was that lots of women had the symptoms, the struggles, the pain, and they were struggling to kind of make sense of it. And so through that, what came about in apparent, through therapy and looking at some of the factors that were brought to sessions, was around how are they coping, what are they doing to reduce their pain. And what I found was that with some women, they would be turning to sort of coping mechanisms that would actually contribute to weight gain in an attempt to kind of manage their pain or manage their emotional distress. So it wasn't actually treating the root cause of what was going on for them. And it was made very difficult by the fact that some of them didn't know where to go, or which consultant or which medic was actually going to be able to help them, because there's not a mainstream service, especially in that time. We're talking about 5 or 6 years ago now. So
and even that hasn't even changed. I think in recent terms, we do have in the UK, there's the BSG centres and pathways in there, but usually they're only taking cases that are very severe. And Ireland is now going to adopt a very similar model. But unfortunately, that doesn't help their patients on the day-to-day basis, and, while you're waiting for surgery or a diagnosis, or even if you're post-surgery and post-excision, which is one of the better types of surgery that you can have, there's still lots of challenges within that. And, you've mentioned there the coping strategies, and, food can become a coping strategy and a control mechanism for a lot of people. And certainly overeating or undereating, comfort eating as well too, are things that, like, I've seen a lot of women struggle with. And in terms of those unhelpful behaviors, what would you think, that patients can sort of help, themselves to identify maybe those behaviors first of all, and how maybe they could help, develop healthier habits around that?
Yeah, absolutely. In terms of those unhelpful behaviors, um, it's crucial really to kind of really identify those, because it can impact on the person managing the symptoms or managing their condition effectively. Unhelpful behaviors can be barriers to adopting good coping strategies. So if we want to improve someone's quality of life, women that are living with endometriosis, and we want them to better manage their condition or their symptoms, trying to tap into their unhelpful behaviors would probably start with looking at, obviously, their unhelpful thoughts, because in psychology, what we know is that the thoughts are the drivers often for feelings, emotions, and behaviors. So I think a good place to start really in terms of the identifying part is to really become aware of those unhelpful behaviors. What's the situation that's causing that behavior? What are the triggers? Even from the minute detail as what time and place, those are the kind of things through psychological support that psychologists like myself do. And the other part also is looking at the unhelpful kind of, let's say, information that people may have received. So there's a part there for self-education, educating the patient to really understand and come to terms really with some of the symptoms around what it is they're experiencing as well. Other ways to identify unhelpful behaviors is to look at things like journaling. Sometimes people prefer that. It's more you and the journal, if you like. So, you can keep a diary by, again, looking at your triggers, the patterns. The more aware somebody is of their unhelpful behaviors, the more that it brings it to the conscious level. Because a lot of the times as humans, we kind of repeat things, and the more we repeat things, the more automated they become habitual. So unless we take this time to educate, to become self-aware through self-monitoring and journaling, the greater the chances are that we can actually then go on to develop new habits and healthier habits. So other unhelpful behaviors, I guess, to add are things like stress, that can be caused by thought processes as well, medications, diet, those other additional components that tie into self-management of a chronic condition like endometriosis, again can lead to unhelpful behaviors as well. So really important place to start, I would say.
Yeah, so looking for the patterns and maybe looking for the signs and symptoms that are there as well too. And those living with endometriosis are sort of used to that, because often they keep quite detailed symptom diaries when it comes to trying to get a diagnosis. And I think maybe the act of writing something down as well, is probably quite beneficial, because it makes it quite real when you sort of see it in front of you as well, doesn't it?
Absolutely. There's such a huge body of evidence now around a written emotional expression. So often what happens is we hold on to our thoughts that turn into these quite severe emotions and can cause a lot of distress. So the body holds that, and over time it can be quite a big burden to carry, and sadly it can lead to more complex mental health issues as well. So the more we can express our sort of thoughts and emotions by using a journal or a diary, what you're doing there is you're going through that process of, and it's not an easy process, actually. I've found many patients that actually, when it comes to writing things down, they find it very, very difficult. And what I try to do is help them to validate that, to normalize it. So that's absolutely normal. It's going to feel alien. It's out your comfort zone, even though it's you and a pen and paper. you will feel the emotion that comes with writing, but actually it's a really effective way, very therapeutic, to release those emotions and thoughts from the mind and body. Because once you do that, it's kind of, you've brought that to light, you've brought that to surface. So you've kind of created a space where you know, when it comes to the next part of, let's say, therapy, you're kind of a bit more ready for it as well, because now you've brought that problem or distress to light, if you like. You made it come alive. And that can be a really, really difficult thing to do.
Yeah, it's you know, it's amazing that something that sounds so simple as just writing something down, and you think, well, we write things down all the time, but to sit and think and to allow all that to come to the surface, you know, it's powerful, isn't it? And I'm fascinated by that because, again, when you've gone through maybe a difficult path to diagnosis, or maybe you're waiting on a diagnosis, and maybe somebody has, you know, dismissed your symptoms, be that within your family or within your social circle, or, you know, even from healthcare professionals as well, there's going to be a lot of anger and a lot of, you know, trauma and a lot of stress that sort of comes along with that too. So after that sort of step of maybe trying to get all of those sort of feelings down onto paper and trying to get your head sort of straight as to what's going on, what would be the next step for somebody?
So I guess the next step would be, so if we were to call that step the kind of self-monitoring, self-awareness, really tuning into, you know, your thoughts, feelings, emotions, bodily sensations, you know, once you've brought that all to light, then what we would do is we'd look at some therapeutic interventions. And again, interventions are evidence-based, you know, that have been, what we mean by evidence-based is, you know, research that has, you know, spent a lot of time, you know, we've gone through kind of testing it out, if you like, the intervention. Yeah. So if we were to look at an intervention that's around self-compassion or acceptance, you know, with working with a psychologist, what would happen there is that you know that what you're going to be introduced is tailored, it's bespoke to your needs. So every individual, every woman, they have different needs, you know. So it's at that point, the crucial bit is tailoring the intervention, making sure that whatever therapeutic intervention, is it suitable for this person? Are they happy with the intervention? Can they work with it? Do they have the resources to actually, you know, try this out? And a lot of the time, what I say to patients is, let's try it out. Let's test this out. You know, it doesn't have to be perfect. We're all humans. We're all going to have our good days and bad days. And the number one thing is compassion. So being kind to yourself when you are doing these interventions and you are going through a course of therapy, because it's something new. So, you know, and that in psychology, what we often have to make sure again is that, is this the right time? So I assess for readiness for change, because what happens is, although a person has all these thoughts, feelings, unhelpful behaviors, there might be something going on for them that actually is a huge barrier. And through conversation, we identify that. So is this the time now for you to engage in therapy so you can get the best out of it? Or is it in a week's time or a month's time? You know, so that, again, that kind of line is really, really important to kind of assess in collaboration with the patient. But if all goes well and we're all ready, the patient's ready, they're happy to engage, they're ready, they've got the resources, then next step would be to kind of assess their thought patterns in that minute detail, if you like. So we call that, you know, identifying thoughts, unhelpful thoughts. And then again, depending on the intervention, we could either look at restructuring some of those unhelpful thoughts, or we could look at some more acceptance type thought strategies or interventions. Again, it's really tailored to the individual, because some people don't like the idea of changing the way they think. So in that situation, I would then look at other interventions that are more around noticing the thoughts. They're here, they've popped up. And then again, how do we manage those? Because the most important thing around our thought process is that they're all, again, we have about 80,000 thoughts a day as human beings, and they often, what the research shows is that at least 70% of those are not helpful. Add a chronic condition to that situation, then that percentage is even higher. And a chronic condition like endometriosis, as we've highlighted already, that, you know, research is limited, that, you know, the care plans, care pathways are very limited. So it's not a chronic condition that's already established, that has a medical pathway and a treatment pathway. You know, it's much more trickier for women because, you know, there's a lot of uncertainty around it, especially in terms of treatment as well. So yeah, it would really be following the lead of the patient, and each step of the way, it's more an iterative process, if you like, as well. But the therapeutic alliance it's created and the interventions that are introduced will always be evidence-based.
That is fantastic, and that's something that, you know, I try to make sure that we include in everything that we talk about, because without the science and without the evidence behind it, it's very, very difficult to sort of justify any treatment, isn't it? And we can learn from so many other chronic illnesses. We can learn from a lot of other conditions and apply those tools and techniques as well for endometriosis. And I think one of the things that I see a lot in women with the condition is that they feel maybe a lot of shame and a lot of guilt around not just their pain, but the fact that it might be linked to menstruation, or the fact too that there may be infertility at play as well, or they may feel that, you know, they're not performing as well as a woman should, and that comes like a very loaded statement. I hear that all the time, where women will say to me, look, I don't feel like I'm a good sister, I don't feel like I'm a good friend, I don't feel like I'm a good wife, I don't feel like I'm a good partner. And, you know, you even hear women saying they don't feel like they're good mothers because they're suffering so much. And is that sort of guilt and shame something that, you know, we can work on, and something that we can sort of maybe, you know, help identify those feelings and maybe work on sort of resolving that as well?
Absolutely, yeah. I mean, you know, if we think about, again, if guilt and shame across chronic conditions is quite a common kind of theme or experience, if you like, that I've heard, especially, you know, when it comes to, for example, weight management or a diagnosis of a chronic condition. You know, the patient goes through that journey of adjustment, and with that comes that guilt, like, did I do something wrong, or what are my family going to think now, you know? And there's a lot of those questions that start to come about that create these thought patterns and lead to those feelings of guilt and shame. So we know that from the literature that, you know, these are the kind of emotions and feelings that patients have when it comes to a chronic condition. But I guess, again, in this situation, you know, it is, I guess it's looking at how to support women when they do feel this. Where do they go? Like, where can they turn to? So it's really important to kind of bring in information, if you like, in the terms of, let's say, psychoeducation. So helping people to normalize and validate their emotions here is crucial, because by doing that, by telling somebody that actually what you're feeling in terms of the guilt and the shame is absolutely normal, it's not uncommon. And when I've said that to patients in clinic, it's like, you know, it feels like they relax a bit more, the shoulders are less tense, you know, you see the physical changes in the way they sit in the chair as well, because now they start to feel like it's not just me, you know. And again, there's that human side to us, you know, we like to feel like we belong. And when we don't feel like we belong, this is where these feelings of guilt and shame come about. So as a psychologist, my role is really about helping people to really validate their experiences without any judgment, because that's absolutely important there. You know, we don't want people to feel like they're being judged. And again, tapping into things like self-compassion is very, very effective form of a therapeutic intervention when it comes to guilt and shame. Because when people experience guilt and shame, what's happening there, underlying the guilt and shame, is fear. There's an underlying fear around, let's say, a loss in identity, loss in functioning, and loss in our sense of selves. And when we feel that fear, that's where these other emotions then start to sit on top, the shame, the guilt. So building in self-compassion is really important, because as a human being, we have an emotional system. And within that emotional system, we have three components. We have threat, drive, and soothe. Now, when a person is feeling the guilt and shame, what's missing is that self-soothing system. So what's activated, though, is the threat system. And when our threat system is activated, we're living on that fight or flight mode. And with that comes a lot of other unhelpful symptoms, a lot of unhelpful thoughts and behaviors. So if we can help women, living with endometriosis, or, they're on that journey of diagnosis, or managing that sort of chronic pain that comes with the condition, building in that self-compassion through therapy would be really, really helpful. And within that, we would try to align those three systems, the threat, drive, and the soothe. So if I haven't explained drive, so drive is just us on a daily basis, doing our thing, attending to all our tasks and responsibilities. We're on that sort of, if you like, driver's seat. And beside that, we've got that threat system that's on alert. But what's missing is that self-soothing system. And that's where compassion lives. So we need to kind of plug that out, bring it out by engaging in self-soothing activities to reduce that guilt and shame. And how do we access the self-soothing system? Is by looking at a person's values and their goals, or even just values alone is enough, because goals can come a bit later on. When we look at values, we're looking at someone's most important things in their lives, the things that bring them happiness, the things that bring them meaning and purpose. Because again, as humans, we need that. We thrive off purpose. And when we have that sense of achievement through anything we do, we feel good. When we feel good, there's not going to be much room for that sort of focus on shame and guilt as much. We may not get rid of it, but if we can have 5 minutes of just self-soothing, then that's 5 less minutes of guilt and shame, which is going to kind of really help that nervous system to kind of stay off that fight or flight mode.
That makes so much sense. And you've put it across so well there, because I think, we're often accused of catastrophizing, and we're accused of all sorts when it comes to, describing our pain or describing how we're feeling. So we tend, to push all that away and maybe try and push through things. But we hear a lot about self-care, but when you've described it like that, where you need to shift from one type of, thinking pattern into another, and that can be done by very simple steps as well. It's fascinating, isn't it? And in terms of, say, for patients who've, been told that they're, experiencing, what the symptoms that they're experiencing, maybe that they're over exaggerating, or that they're feeling, that they're not being listened to or anything like that. Can you discuss maybe the concept of catastrophization and how that can worsen the experience for a patient?
Absolutely, yeah. I mean, catastrophization, again, we all do it. I think it's just one of those unhelpful thought patterns that, I'm sure many of us have kind of experienced in different situations. And what we mean by catastrophizing in say, psychological terms is again, it's going back to our thought patterns. We can often have distorted thought patterns. So thought patterns that are not true, for example, but actually they're made worse by the way in which we think about a situation or think about the way we're feeling. And what happens is that the more we catastrophize, so the more we interpret something that's you know, not good, not great, or it's really, really bad, or it's the worst thing, it creates that feeling of helplessness. So what happens there is that we feel out of control. So now we're not in control, and either somebody else is in control or something else is going to take over. So that feeling of helplessness can make, you know, it can make us feel quite weak, if you like. It can really feel like we can't do anything to change this situation. And I guess in the case of endometriosis, an example of this can relate to catastrophizing of symptoms, for example, especially if a woman's in a very early stages of trying to get that diagnosis, trying to understand the condition. Catastrophizing can bring lots of worry, rumination, negative thinking as well, and feeling of overwhelm. So all of these different ways in which somebody might think about things or experience can kind of come under the umbrella of catastrophizing the situation as well. And often what can happen is the body actually interprets that. So again, going back to that that alarm system we all have, the threat system, that gets activated, if you like. It turns on. So when that turns on, our nervous system starts to be on fire, if you like. It's on high alert. Is detecting that threat. So that thought, let's say that unhelpful thought, that negative thought around a certain situation related to the condition, can create that emotional distress in somebody. So it can create fear, anxiety, helplessness. But actually, let's say, for example, somebody's experiencing pain. What can happen there is that it can actually impact, so the catastrophizing can actually impact on the perception of pain. So if I break that down, what we mean by that is that what the research shows is that when we catastrophize, we create bodily signals, sensations in our body that heighten that experience of pain. So, for example, just by focusing so much on the pain, the body thinks it's actually, the pain's getting worse, but actually it may not be. But that interpretation, it's quite a powerful reaction between that mind and body that takes place. But those emotions, again, you're going on in this spiral. It amplifies the experience and makes it harder for the person to cope and manage with that pain. So that person starts to feel even worse. They feel like this is just unbearable. And, you know, they just start to feel like the pain's getting worse. But actually, because the focus is so much on that pain, those feelings that are generated are making those sensations even more powerful, if you like.
Yep. And would that explain then why often, you know, especially for, you know, flare-ups and chronic pain and that, they would often say to use like a distraction technique, or to maybe, you know, we've seen some people prescribe mindfulness courses or other things to help take their mind off it. Like, and I know sometimes, you know, one of the things that I had done on a chronic disease self-management course was, it was something as simple as the letters of the alphabet. Think of a vegetable for every letter of the alphabet, to try and break that brain pain cycle. Are techniques like that useful?
Absolutely useful. Yeah, definitely. And I think sometimes they can feel a bit like alien, if you like. But this is where I guess support, therapeutic support, can be really, really empowering. Because if you were to go and try that, sometimes, let's say if you're really experiencing the pain, you might be unlikely to believe that something like mindfulness is going to work. But if you do it with support, with the right information, the right context and environment, then the outcomes are much, much better. Now, here in the UK, we have a therapy model called acceptance commitment therapy that's been, you know, it's part of our clinical guidelines, and NICE guidelines have approved that for pain management. And I've certainly used that model across the conditions that I've worked with, still use it today, absolutely love it, because what that model does is that it's not asking you to change the way you think, but what it's asking you to do is notice, as I said earlier on. It's a different type of therapeutic model. But the good thing about it is that it helps, like you said there, Kathleen, it helps you to really focus on engaging in activities that make you feel good. So those activities that are focused around your values, and what we mean by values are those things that are meaningful and important to you. If you can work on those, really plug them out, because often we don't even know about what our values are unless we actually sit down and think about them. So there's about 50 different values that a person in therapy would actually be introduced to and would own. You know, you look at this sheet and tell me, what are your values? And when you engage in those values at that point of a difficult situation, a difficult thought, emotion, sensation in the body like pain, we have a choice. We either work on towards the life we want to live in line with our values, or we move away from our values and carry on doing what we've been doing all along, which actually in the long run isn't going to improve your situation and make you feel stuck even more. So yeah, with ACT, you know, we'd look at values. Mindfulness is a key component of the therapy as well, looking at relaxation techniques. And the reason why we do that is that these techniques have been shown to calm the parasympathetic nervous system that we all have. When that nervous system, if you think about it in terms of a thermometer, okay, so if your pain sensations are heightened, you've got the catastrophizing going on, let's say, you know, your nervous system is at 100 degrees, it's on the maximum now, and you can really feel it. You know, you might even start to feel like your heart is racing, you might be sweating a little bit, you're just really feeling on edge, shaky, for example. By introducing the brain, because a lot of this comes from the brain, introducing the brain and diverting the brain's attention to a mindfulness breathing technique, for example, what you're doing now is bringing that 100-degree thermometer down to, let's say, 70 to 50 to 40, and you will immediately, you know, when you practice mindfulness, you will immediately feel your body softening, and you'll feel that nervous system calming down. So, and the evidence base for, you know, mindfulness, pain, ACT, it's huge. And it's shown to have really, really good outcomes for patients in this situation.
That's brilliant. And I'm sure that there are techniques that you can practice on a daily basis that you can prepare yourself and to sort of down regulate your whole system ahead of maybe flare-ups and ahead of crisis conditions. Is it something that you could sort of do every day?
Absolutely. And that's the key thing. You want to, you know, over time, what we do in therapy is that therapy really is about helping patients to learn about skills, information, skills, and techniques. That, you know, if you want to look at therapy in that way, it's a learning part of, you know, your journey to learn something new, to become unstuck, and to feel more empowered, more in control of your condition. So what you want to do is, you know, we start off very small. So try it for a minute, try it for 2, 5, 10. You slowly introduce it so it becomes a habit, because again, a lot of the time we don't think about our brain. Our brain actually is a creature of habit. And that's why when you introduce anything new, whether it's a 5-minute mindfulness or a 1-minute mindfulness, the brain will try to reject it. It will be like, what are you doing? What is this? You know, and the discomfort will be a physical one, guaranteed. And where you may feel it the most, people describe it, and certainly I've, you know, when I've engaged in something new or something that's fearful, I feel it in my tummy, for example, you know, the butterflies, but that's normal. But often what happens is people, once they get to that point, they'll turn away, you know, but through therapy, what we do is actually, no, let's kind of engage with this. Let's try to override that difficult emotion, those feelings, because once you override them, that's where change begins. So, you know, with change comes discomfort. So if you're introducing some relaxation, mindfulness, yoga, anything, any activity that's going to be beneficial, it is going to feel a bit alien. It's going to feel a bit uncomfortable because the neural pathways in the brain haven't been created. So of course it's going to feel a bit different. But by you repeatedly engaging in those behaviors, those neural networks are then formed, they become automated. And then in fact, you start to realize when you don't do mindfulness on one day, you might feel like, oh my gosh, I've missed it. And I can feel the difference. So yeah.
Oh, we are pure creatures of habit, aren't we? We love our comforts. And, sometimes that can just be, coming in, throwing ourselves on the couch and wrapping up in a blanket and, sitting there for the evening. But when you do get into the habit of doing something like that, even if it is only 5 or 10 minutes, certainly from my own experience, I can say it has made a huge difference, not only to your mindset, but to your physical health as well, too, because you can feel where you break that sort of stress connection as well, you're lowering down all your stress hormones and all of that as well too, and you're giving yourself that, even that 5 or 10 minutes, just to get the heart rate down, get your breathing under control and that too. So it has huge impact. And I think for me, from listening to what you're saying there, it's very important that this is a guided process. I think that given patients that are living, with a chronic condition, or maybe living with severe pain, or maybe have been living, under a huge amount of stress for a long time, that if you're at the point of burnout, it would be very difficult to do these things on your own. I think the support of a psychologist, I think, would be very important in this. Um, how could you encourage somebody to take that first step if they're completely burnt out and they're thinking, okay, I want to change, but I'm frightened. I don't know where to start.
Yeah, absolutely. And often, you know, we do often leave things, don't we, till the end, if you like, or once we actually physically and emotionally have reached our maximum kind of capacity, you know. And if that is the situation with burnout, for example, to even contemplate therapy might feel very, very challenging, very hard. And I guess the other thing is that confidence and self-belief might be quite limited. So even though a person knows that I should perhaps access therapy, or I need to access therapy, so there's that want and desire, what might make it more difficult is that, oh, well, what if I fail? What if I don't do well? What if I can't do, again, those unhelpful thoughts. So in that situation, what I would suggest, I mean, what I do with clients, if you like, is give them that kind of discovery call, or that kind of initial conversation where there's no obligation. You kind of just speaking to somebody that actually understands. Again, there's that non-judgmental piece there all the way through. There's that validation piece. So even if you just spoke about it with a professional, and going in with an open mind, that actually just by talking for 15 minutes about what it is I know I want and need, it might actually change the way you then walk away from that conversation. You might even feel like, actually, I can do this. I can create space. And I just, you might find that by just talking about it, you've kind of solved your own sort of unanswered questions or uncertainties. Again, it's very powerful. It's very therapeutic to talk, talk. That's why we have things like talking therapies. Because it can just kind of release some of those uncertainties or heightened emotions around access as well. So I guess what to highlight there is, yes, the initial stage, especially if you're feeling burnt out, can feel quite difficult. But just to know there's never really any obligation to kind of tie into something if you're not 100% sure, or it's just not the right time for you. And if it's a good therapist, they will see that too. They will advise you on what the best thing is to do.
Yeah, the first step is always the hardest, isn't it? And I think it's like anything, like any healthcare professional, you have to find somebody that you gel with and somebody that you trust. and somebody that gets you. And we're all so different as well too. And I say to people, like with a lot of therapists, you may need to sort of shop around. You may need to meet a few people on discovery calls to see who is going to be right for you. But I suppose just to empower people to take that first step is so important, because when you're at that bottom, it can be very difficult, to see a way out of it. And certainly when, the treatment patterns or treatment plans here are very, very limited as well. So I suppose one of the things I would like to see in endometriosis care, and it's starting to come in slowly, it's coming into the conversation, but the formal links are not there as well. And how do you think we could improve the communication between healthcare professionals such as gynecologists or pain specialists or even GPs referring to psychologists like yourself? Because often we don't know you're out there, and we don't know what help and support is available or what it would actually look like if we did access it.
Absolutely. It's a really, really good point, actually. And I guess it's a point that sometimes I even reflect on in clinical practice, is that, a person's journey when it comes to chronic illness, it's the communication, I would say, is fundamental. I mean, certainly in health psychology, it's a huge part of our field. We study it, right from the outset. Because with communication comes language, and the language we use with people can really impact on their journey. It can really either disempower someone or empower someone. It's one or the other. Previously through my training, we did lots of work around training healthcare professionals on communication skills, on counseling type communication skills, like motivational interviewing, for example. Because with a chronic illness like endometriosis, the key thing is self-management. The person is going to have to, along the journey, once the diagnosis is formally there, or even when they are going through that phase of diagnosis, there's going to be phases where the person has to take responsibility for their condition, and that's not easy at all. And so communication about the condition, which in the past has been a huge bugbear for me, because I've met lots of patients actually don't understand their condition, don't understand why they're taking their medications. And if those two things are not understood, then how is that person's journey or their outcomes going to be made better? They're not. So improving communication from the outset by firstly providing that patient with the right information, accurate information, it just has to happen, because that is where the person learns about their condition. If they understand their condition, then they're more likely to adhere to the regime, to adopt the self-management strategies, engage in things like healthy diet, exercise, lifestyle, all of those things that need to happen for every chronic health condition. Now, how we can improve that communication between, let's say, the multidisciplinary team, I would say is probably still work in progress, but not impossible. And I think it takes a lot of time and effort. And certainly in my role, I've gone into services where I've actually been the sole and lead psychologist. So a lot of the time I've spent is training healthcare professionals on how to have a conversation with patients. I know it sounds a bit like, well, we should all know how to do that, but actually it doesn't always happen in clinical settings. And simply often is because of pressures, time. Time is always the number one barrier to effective communication. But actually, it's not good enough, really. I think we need to invest that time. And the good news is training healthcare professionals in conversational skills, communication skills like motivational interviewing can actually reduce time. There's a huge evidence base for that. Asking open questions, for example, is one way of extracting information from the patient. We want to know, we want it to be person-centered, we want it to be collaborative. And for that to happen, we have to ask open questions, not closed questions. So there are some techniques there that healthcare professionals are adopting. You know, in certain disciplines, they have to have that MI training, the motivational interviewing training. So, you know, it's essential to helping patients to manage effectively. I think the other thing is those skills around, you know, again, compassion, self-compassion, trust. You know, when we communicate with somebody, you're not only giving them information, you are then creating that alliance between you and the patient. And with that alliance has to come empathy for their situation, for their symptoms. You know, there needs to be a level of trust. The patient needs to feel they can trust the clinician as well. So all of those things are going to, in the end, determine, you know, the patient's quality of life, their functioning, their mental health. There's everything around that person's life is going to be impacted, you know, once they are living with a chronic condition. So if we can just get the basics and the beginning of that journey, you know, as much as we can, you know, invest in that quality of that kind of communication, that's the key to good patient care.
It would make a huge difference. And I think certainly in the case of women, because often, you know, that initial conversation could be quite crude, or it could be quite, you know, badly worded as well, to the diagnosis even of endometriosis, suspicion of it. You know, often the straight you know, straight to hormonal treatment, or straight to a conversation around fertility, or again to back to that conversation of where maybe they're not believed, or they're not, the patients feel that they're not believed because they feel like they're not being heard. So I think there's huge scope for that. And I think, you know, when patients are empowered and they become good self-managers, like I've certainly seen, you know, where patients have basically become sort of like managers in their own healthcare team as well, and they're able to communicate themselves effectively. And that, a lot of that comes through speaking to other members of the community, and maybe, you know, doing some self-awareness work themselves, and doing a lot of therapy work to be able to express themselves and be able to get their points across. And I suppose that brings me to the social support and online support as well too, for people with a chronic illness. Do you think that, you know, there is like a strong support system there? Is it adequate for patients, or do you think that there are risks for patients as well?
Yeah, I think, I suppose a good thing about conditions in terms of information and support outside of the healthcare system is that there are sort of places or organizations, there seems to be anyway, for each chronic condition, which is great, because I guess what happens there is that it creates that community, again, that normalization, and people get to connect with people that are experiencing, you know, similar things as them. And again, if we think about us as humans, we, you know, we thrive off social connection. You know, we are so social beings, if you like, and that's why so many of us struggled in lockdown during COVID, because we wasn't able to do that. You know, we were restricted, and again, we don't like being restricted as humans, whether it's children or adults. We don't really like being, you know, restrained for too long. So social support is crucial with anyone with chronic illness, because what it does is that it kind of helps people to share that lived experience. Yeah, so there's those pros, if you like, in terms of shared experiences, mutual support, for example. Emotional support, again, you know, you'll probably find that from people that are having the similar experiences as you. And then there's, of course, resources, advocacy for change, and all of that comes with being part of an online community or social support groups. And I suppose, in answer to your other question, you know, I think there can be challenges. maybe more so online, for example. You know, sometimes being online, the power dynamics are different as opposed to being in person with somebody. I think sometimes being online, and certainly I've noticed that with doing online therapies, that people are more vocal, a bit more expressive, whether that's in chats or whether that's just verbally saying how they feel. And actually, sometimes that can be quite difficult for people that are more, let's say, introverts or struggling, or, you know, there's personality differences, if you like, when we're in a social setting anyway. So I guess some of the challenges of being in an online group or accessing that social support is to be mindful of, really. It shouldn't put you off accessing it, but just to be mindful that there will be group dynamics there. You might meet strong personalities there. There will be differences of opinions and concerns. And especially if you're online, be mindful of privacy as well. So making sure whatever you share is, you know, that there's some kind of limitations around that in terms of the group that you're in, and everybody's aware of that as well. And also I'd say just be mindful of the pressures to adopt information. I would say, you know, I'm very much, again, going back to evidence-based, I'm very kind of mindful of, you know, misinformation or information that's not accurate as well. So there's lots and lots of that out there in terms of the platforms we may all access, social media platforms. So just make sure that the information you access is credible, and just be mindful of any sort of misinformation as well. So, but, you know, social groups are valuable. They're valuable. They can be supportive. And, you know, if you're not getting the care and support at the moment, let's say through the traditional services, then this could, you know, it can be a lifeline for people, you know, just to have that connection with others that understand them.
Absolutely. And I've seen that certainly in the endometriosis community over the last 20 odd years. I've met people who've become good friends, and, you know, I know people who've gone on to meet people who've changed their lives in such a positive way. And yeah, the socials do have their downsides, but I think, you know, that positive side can outweigh it as well too. And I think for a lot of endometriosis patients, it may be the first time they encounter accurate information in their journey as well too. But we do in the community have a lot of issues with misinformation. And I suppose, like all health information out there that's online, it's hard to counteract that. It's a huge flood. It's tricky.
Absolutely, yeah. And it can actually feel overwhelming, and people, you know, there's this thing in psychology we have in terms of it's like a curveball about information. You know, you could either overload somebody and there's no change happens, or they have lack of information and again no change happens. So it's about just, you know, placing information and accessing information that is retainable, you know, for yourself as well.
Yeah, and accessible for patients, because
Yeah.
people have different, you know, at different stages and at different times have different needs as well for information, don't they? So it's a
Yeah.
huge curve. Neesha, it has been fantastic chatting to you. I have learned so much tonight, and I'm looking forward to listening back to this myself, because I really want to take in everything we've chatted about. Can you tell me just how we would get in touch with you and how we would make an appointment? And for people who maybe can't reach you, how we would look for somebody who is a qualified psychologist in both the UK or Ireland?
Yeah, absolutely. So I'm available through Evoking Health Ltd. So my email address is info@evokinghealth.co.uk. I'm also on the socials, so Instagram at Evoking Health _Dr. RP. And I'm also on LinkedIn as Dr. Neesha Patel. If you just type my name in, you'll see my profile there. In the UK, we also have our online sort of psychology network directories, if you like. So you can search for accredited healthcare, health psychologists or therapists as well. And that's through Psychology Today as well.
Brilliant. That is great. Neesha, I'll pop your details in the show notes as well,
Sure.
so people can reach you. That is fantastic. thank you so much for joining me. And Neesha, that has been, absolutely brilliant. And I think everybody will have learned something and, hopefully take that first step, into accessing some psychological support for themselves.
Yeah, thank you so much, Kathleen. It's been
No
great
problem.
just to speak with you this evening.
Brilliant. Thank you. And thanks everybody for listening to this episode of DEARG, and we'll chat to you all again soon.